Hope Channel, changing lives.
Hello, good evening. It's Wednesday. I'm on your screens again on Real Talk, right here on Hope TV. We have a story to share with you like we always do. We get our stories from you out there, real life people going through challenges, work issues, career issues, family issues, relationship, what have you. Just send it to us. We are here to listen, we are here to talk about it, and we are here to give you solutions at the end of the day. We find you amazing panelists, far, near, people with the knowledge, our resource persons, and even just a regular person to give their point of view. Today we have an amazing story, a sad one that will make you question what is going on. It's all about odor. And this one we are concentrating on mouth odor, bad breath. It is an issue that I am sure people who are going through it lose their confidence. They don't know what to do. Imagine talking to a friend and you know you have a problem with mouth odor. You can't even come out and talk. You have a presentation at work. You have to talk to people at church. When people get close to you, you will be moving away from the people. And immediately someone steps away, you start thinking, is it because my breath stinks? I'm sure this is a common issue. Another name for it is halitosis. People are going through a lot in the world, and we are trying to get you to talk to us because keeping these problems within can cause depression, isolation, and all kinds of issues. So please feel free and send us your story to our WhatsApp number or email address, Realtalk, Hope TV, and we will find you the right people to talk about it. Today I have amazing people joining me virtually and in the studio. There's a little twist today. I'll introduce my virtual guests to you. Go and take a look at our story. Come in and show you my studio guest. It is a little surprise, so don't be surprised when I do that. I have Mrs. Lydia Odum joining me. If you can hear me, please say hi to my audience.
Hi. Hi, everyone. Good evening.
Hi, good evening. Good evening. Welcome once again to Real Talk.
Thank you.
How are you doing? How is the family? Coronavirus is in. How are you protecting yourself? Just give us a little bit of your day.
Evie, it's not easy. But by the grace of God, the family, we are all doing good. We are taking very good care of ourselves.
Right.
We don't want to get into trouble. But I want to tell you, it's getting bad. So in terms of the COVID, so I always, encourage, advise people to take care of themselves, boost their immune system so that it's, even if you get it, it's not going to harm you that much. But don't be negligent because it's real.
Right. Are you still under lockdown or it's a partial one?
No, we haven't. I'm in New Jersey and we haven't started yet.
Wow.
So, yeah.
Wow. We will continue to pray with you. Ghana, we are somewhat lucky to have cases that are not as severe as you guys in the States. We'll continue to pray with you, and I know you will be safe. And then when the time is right, you'll get to me.
Thank you. Okay.
My other Zoom guest is Mrs. Awajo Abano. Please, can you hear me? Say hi to my people.
Hello, Evie. Hello, everyone at home. Watching us from Sunyani, all the way from Sunyani.
Yeah. How are you doing? You are a nurse. You specialize in something that I would not even try. I will make the attempt on mentioning it. Please tell me the type of practice nurse you are, and then what exactly you do.
Okay, I'm actually an eye specialist in nursing, if I should put it in simple terms. So I've specialized in eye nursing.
Okay.
So yes, I focus on eye problems, but I was a general nurse before specializing. Right. So I know something about general nursing, about general conditions, and what have you.
Okay, welcome to the show once again. And I'm sure when we start the discussion, you would have a lot to talk about, especially with your background in nursing, which is health or medicine. And we'll take a look at our story about a young lady who is going through hell and she needs help. So do not go anywhere, stick and stay, look at our story, we'll come back and I'll introduce my amazing studio guests to you. This is Real Talk, we'll be right back.
Dear Real Talk, I pray this issue of mine is discussed so I can get some help. I am a young woman who is considered attractive. I have a good job and financially stable, but I have a huge problem. I have halitosis, mouth odor. My ex mentioned it to me just before he broke up with me and said he could not be with me anymore. And I think that is what is preventing me from finding a man. I have noticed how colleagues would avoid getting close to me when we chat and even how they move away from me when I get close to them to talk. I have become withdrawn and antisocial because of this. My self-esteem is going down. I have tried mouthwash, brushing my teeth twice or even more a day, using charcoal with plantain peel, but still I see no improvement. I don't know what to do again. Please, I urgently need your help. How can I get rid of this bad mouth odor?
Welcome back. I am sure you have seen our story today. I told you it's a sad one. She is financially independent. She has a job. She is attractive, but she has this issue of bad breath. And her ex left her because of that. Oh, but you too. You should have helped her along the way. Anyway, I have in the studio with me a doctor, a dentist, who would tell us why we suffer from bad breath. So please, welcome Dr. Kwabena Koduya.
Thank you very much.
You're welcome. You're a dentist. Is this a common issue?
Yes, a lot of people actually suffer from halitosis or bad breath. And then I think there's a survey was done and it was found that about 50% of the population at a point in time suffer from halitosis. So 50%. 50% of the. So at a point in time, so it's something that we all suffer at a point in time. So it's common, and then it's also found that about 2 out of 10 adults also suffer severe halitosis, and then which needs to be treated so that they also they won't feel bad amongst their colleagues and all that.
Okay, my next guest is Mrs. Perfect Kuma Ojo. You are a counselor.
Yes.
Has anybody come to you with this issue before?
No.
Maybe they are shy.
Most people don't talk about it. Like as the reader did, they will be trying to solve their own issues unless they get to a point they can't handle it before they want to come out to seek help.
So looking at how it's affecting her confidence, I'm sure people come to you with confidence issues, how they can get over it, and so on. So today you'll be sharing some tips with us, on
Welcome.
Thank you. Okay, so we'll start and I'll come to you, doctor. I'll ask, what is halitosis?
Okay, so I would say that everybody has a peculiar, breath, but it becomes an issue when it's beyond the socially accepted, limit. So when it becomes offensive, so that's what is termed halitosis. And as I said, a lot of people suffer from it. And then I would say that to talk about it, I would like to classify or classify the types that we have.
Okay.
So that to make things more clear to us. So we have genuine halitosis, and then we have pseudo halitosis, and then halitophobia. So the genuine halitosis is when a person suffers from the actual halitosis. I mean, so I mean it's caused by something called visible, we call they are sulfur compounds which the body produces, and it's very offensive. So when bacteria in the mouth ingest on the food particles that we eat, the remnants of it, they produce offensive sulfur compounds, and then that leads to halitosis. So that's when we have the genuine. So the genuine halitosis is when the person actually has the bad breath. And then there's also pseudo halitosis. Sometimes some people think that they have halitosis, but actually they don't really have anything, I mean, clinically. And then there's quite a number of people who have, I mean, who suffer from that. And then they will come to the clinic and then they will tell you that, I mean, they have halitosis. So usually halitosis is confirmed by a close person. Maybe it could be a wife, it could be, I mean, a friend, a close friend, or the dentist or the doctor who examined the person. So that's when it's genuine. But sometimes people think that they have halitosis, bad breath, but I mean, in actual fact, they don't really have anything.
So it's in their mind.
So yes, something like that.
Wow.
So it's a psychological effect that they have, and then so that's the pseudo halitosis. So clinically, they don't have anything. And then we have halitophobia. So some people, so that one is quite severe. For the pseudo halitosis, with therapy or with advice from the dentist, they are able to, I mean, accept that they are fine. But there's halitophobia, because at a point in time they've been diagnosed of halitosis, or I mean, for that people, they find it very difficult to, I mean, accept that they don't, so they don't actually have the thing. But because at a point in time they suffered from the disease, and then they are doing better now, but they think that they still not recovered from the thing. So that's what we have.
Okay. So just in a brief way, please can you tell us what causes it? Is it purely hygiene, or is something in your gut that is making? So
actually there are lots of causes of halitosis. I mean, but mainly we have the intraoral and then the extraoral. So intraoral is the mouth, what we have in the mouth, and then that contributes to about 85 to 90% of the cause of halitosis. And then we have extraoral, so that's about 10%. So mainly it's from, I mean, issues that we have in our mouth, and then mostly it's due to poor oral hygiene. A lot of people don't, I mean, pay attention to their oral hygiene. They don't brush. I mean, sometimes they brush, but they don't do it properly. And then sometimes too, when we brush, we forget to also brush our tongue. It's very important, because the tongue is known to contain a lot of, I mean, these bacteria, and then they're leftover food particles, and then sometimes when you brush, you forget to clean up, and then it also contributes. They produce these volatile sulfur compounds, which are quite offensive. And then so that's the main. I mean, mainly is intraoral. For the extraoral, there are quite a number of diseases which brings about halitosis. So most commonly this sinusitis. So when people have, so a lot of people have a blocked nose, and then they are always, I mean, discharging from their nose. They have catarrh for quite a long time, more than 3 months. So when they have infection in the nasal, paranasal sinuses, and then also common diseases like diabetes also. I mean, diabetes has, I mean, a lot of effects on, I mean, almost all the organs of the body. So they tend to, I mean, especially the uncontrolled ones, so they tend to have dry mouth. So that leads to, I mean, halitosis. And then quite a number of disease. I mean, so we have, I mean, for people who have liver and kidney failure, I mean, those people, they may not, I mean, actually come to the dentist, but they also kind of produce, they also suffer from halitosis and other gastroesophageal reflux disease. I mean, people who have issues with their, I mean, their gut. So to summarize it up, it's all about, I mean, so there are channels in the body. I mean, you have the esophagus, the trachea linking, the esophagus linking the stomach contents, and then the trachea, the lungs, and then the knees, the nose, and all that. So when there are issues also in the other parts of the body, to which, I mean, these channels all lead to the mouth. So the mouth is is the gateway to the body. So when all these things happen, like when there are issues elsewhere, like the other disease, so even though the oral cavity forms the major cause of the halitosis, there are also other things. So basically, that's, I mean, the summary of
what's cause it. Thank you so much. Counselor, I'll come to you, and then I'll ask you, looking at the story, what is your general take? What do you think this lady is going through?
When I read it, I was quite sad, and I feel for her. I empathize with her. You see, it's not easy to be rejected by somebody you love, and because of that, she has isolated herself from her friends, workplace, and all that. So now she was a sociable person, but now she's quite a reserved person now, and she's afraid to speak up. And now finding love will be difficult for her because she's holding back. And love, you need to express yourself mostly with love. So I feel for her, but there is hope for her. All is not lost.
Okay.
Yeah.
So I just want to pick your mind a little on how, aside treating herself from the halitosis, how she can get back to being her old self, sociable, bubbly person. Because like she said, people find her attractive. She's not doing bad. But for a man that's once said he loves you to stand there and say, oh, this is the reason I'm leaving, I can't be with you, that might be quite painful.
Yeah. So after visiting the dentist, she needs also to visit a counselor, right? Because our job is to help you to understand your situations. Whatever you're going through, the counselor is there to help you, to guide you through it. So she needs a counselor after going through the treatment. Even through the treatment, she also needs counseling. Because now, one thing she also needs to know is the boyfriend left her. But if the boyfriend really loved the girl, he could have stayed to help her to overcome it. So she should understand that the guy was not meant for her. Right. So just looking closely at, maybe the guy even saved her. Now she's aware that she needs to go for treatment. And from the letter, she said that I've been doing this, I've been doing that, without going to the dentist or going to the medical doctor to seek for the right advice. So the guy does not love her. So she should just let it go and come to counselors. Let's psychic her up. Let's help her to know that there's love there. You know, we have people who have serious challenges, serious diseases, disabled. Some even have HIV. Their partners don't have it. But because of the love that they have for them, they go ahead to marry them. So this guy is not into you. She's not meant for you. So just let him go and come, let's talk.
Okay, come, let's talk. As Pepe said, she would have a session with you, and I'm sure by the time you guys are done, you feel like your old self. I'll come back to you, Lydia, and I'll ask you your general take on the story. What came to mind when you read the story? And also, this issue of bad breath. I mean, how can one get out of it in a way of trying to be a social person, trying to get back to yourself, having family close by? Because I can imagine just somebody walking away, maybe not because you just immediately think, oh, the person is walking away because of my bad breath. So please, can I have your opinion?
Yes, thank you. And as soon as I read the story, I just felt pity on this poor young lady. And the fiancé or the partner, the first relationship, she lost the first relationship. The guy, I don't think the guy was really willing to stay with the lady. He didn't want to help her. Secondly, you know, I was happy at the end of the story. So when I realized that this lady hasn't seen a specialist, so there's more to that. There is hope. You know, if she wrote that she's seen everyone and she's done everything, then I would say, oh, then we just have to pray for her. But she hasn't gone that far. The remedies that she uses, just the common remedies. So I'm happy that, she can do more. So she shouldn't. This is what I saw when I read, and then I ended the story. I saw that she can do more too, but I saw that she immediately she lost her confidence. She just she couldn't overcome fear or confidence.
Right.
Fear. She just lost confidence. She shouldn't do that. She was in low self-esteem, and that wasn't right. So I think she should see a specialist, like we said in the beginning.
Right.
So that's my opinion.
Okay, thank you. Awajua, can you hear me? You seem to be having issues with your device.
Yes, I'm back now. I'm fine.
Okay, sorry about that. I would ask for your general take on the story, and being a nurse, any extra comments you have on halitosis, bad breath?
Okay, my general take on the story, I might have a different view, but I think that the guy leaving her is a blessing in disguise.
Okay.
Because before the guy left, he actually told her the problem that he was having with her. And that is a blessing. Because if he had left before, or he had left without telling her, she would have been thinking about a lot of things that might have caused the guy to leave her. But the guy actually told her what the problem was, and he left her. So even if the lady knew before the guy left her, she now knows that is a problem she should handle. She should tackle more seriously. So she shouldn't think about that. It's past and gone. The guy has left a mark. She knows that she has a problem now, and she can tackle it head on. So it's a blessing in disguise. And what I want to talk about concerning halitosis is that, as the dentist mentioned, doctor mentioned, is a problem that a lot of people experience. We think it's not very common, but a lot of people experience it. And because it's difficult for you to tell someone close by that the person has bad breath, a lot of people have it, but they actually don't even know they have it. Some people too have it, but try to shy away from it. They hide it. And it's a problem that we don't want to talk about. So people even find it difficult to report to the hospital with such problems, because you come to the hospital and then all you want to complain about is that you have bad breath. No, people don't really come to the hospital with such problems.
Right.
But it's something that you need medical help on. You can't solve it on your own, because as Doctor mentioned, there are a lot of causes. There are a lot of other causes, such as a lot of sugar intake and crash diet. Some people go on fasting and all that to reduce weight, and all of that can cause some reactions in the body and cause bad breath as well. So there are a lot of causes, there are a lot of things that can make you have bad breath, but you wouldn't know if you don't seek professional advice. So it is important to seek professional advice. She should stop thinking about the fact that her boyfriend left her, what have you. She should face the problem head on as it is now.
Thank you so much, Abajua, for your opinion and your comments. Yes, doctor mentioned that at a point, 50% of the population would have halitosis. That's like 1 out of 2 people, if my math is correct. Yes, and imagine, it's not as uncommon as you were thinking. You're not the only one going through it. All of us, or 50% of us, will go through it at a point in our life. So do not give up hope yet. We'll be back with more content. We'll have to go for a short break, and we'll be back soon. Do not go anywhere. This is Real Talk.
Our nation's democracy will be tested once again on the 7th of December as we choose our leaders in the upcoming 2020 general elections.
Kelakura pleketu sakuntomajikbola wana tokia de si wode nkona ba irini si gombe nyam tifafa.
Irene comes off on Saturday, 21st of November 2020 at the
T-Square Arena, Aflau.
Time is 4 p.m. prompt.
Amakpekpoto Howenya, Bubuto Jifa Gomashi, Bubuto Elliot Adam Agbonowu, Bubuto David Tiano, Holy Amaga.
Participating in music are AME, Zion Church Choir Denu, CK Jizam, and many more. Our partners are... We want you to come. Let's celebrate the peace the Almighty God has bestowed upon our lives. Rate is free. For the lack of knowledge you will perish, as the Bible says in Hosea 4 verse 6.
The grace, the blood of Jesus is there for us. So I can't be sick. I can't be poor. I cannot suffer affliction.
Jesus told you, be faithful unto death to receive the crown of life. We have to go through tribulation, have to go through problems, because there will be no crown without a cross.
The verse says that we would go through afflictions because of his name's sake.
Yes.
There are lots of eye-opening discussions to prepare you for the second coming of Jesus Christ. Join us as we watch the signs with Pastor Kwabena Chum on Hope Channel this and every Thursday at 4 p.m. Hope Channel Ghana, in partnership with Donate Blood Save Life Foundation, National Blood Service, Ghana Adventist Health Service, and the Seventh-day Adventist Church presents the Blood Donation Drive.
Every day we experience and hear of sad events of which people are dying. Many are losing their lives. There could have been a way to save these souls. Unfortunately, there is no blood at the blood bank. And so whatever effort doctors, nurses, and family will do, these people are to die. If we are able to support them with blood and then fill the blood bank with blood, I trust that these people may not die and souls will be saved. That is why we want to invite you. Please be part of the 28th blood donation. Hope TV is organizing a big blood donation day on 28th, and we invite every individual, whether you are an Adventist, you are a friend of Adventist, wherever you are, just come and be part of this program. Donate blood to save a soul. Donate blood, save a soul. Please donate blood to save many souls in Jesus' name. Amen.
The blood donation drive will be happening on the 28th of November 2020 from 9 a.m. to 2 p.m. at the following venues: Bono Region, Sunyani SDA Hospital, Newtown SDA Church Sunyani, Penkwase SDA Church, Greater Accra Region, Tamakomiti 6 SDA Church, Madina Central SDA Church, Dodowa SDA Church, Ashaman Central SDA Church, Odoko SDA Church, Bubuashe SDA Church, Legon SDA Church, Accra City Conference of the Seventh-day Adventist Church, Prince Emmanuel SDA Church, Asante Region, Kwadaso Adventist Hospital, Northern Region, Kaladan Seventh-day Adventist School premises. Donate blood and save a life. 28th November 2020 from 9 a.m. to 2 p.m. Hope Channel, changing lives.
Welcome back from the break. My name is Evie and you're still watching Real Talk right here on Hope TV. We are discussing a story from a young lady. So she says she realized she has bad breath because her ex told her, and that was the reason why he ended the relationship with her. Because of that, she cannot talk to friends. She's becoming antisocial. She's isolating herself. She used to be very bubbly at work, I'm guessing church and with friends, but now she's keeping to herself because she's just shy and she's losing her self-esteem, and she thinks that people are moving away from her because of that, so she needs help. I am here with amazing panelists. I have a dentist, I have a counselor, I have a nurse, I have everybody here to help her with her story. So we'll go right into the discussion again, and I'll ask you, Doctor, first of all, can we treat halitosis?
Yes, it can be treated.
Okay. And then it will go.
Yes. So, I mean, there is hope for, I mean, the lady and anyone out there who has halitosis.
Okay.
So it can be treated. Just that in this time, especially, we have to, the most important thing is for us to find the cause of it. So, as I said, there are a lot of causes, mostly from the oral cavities issue. So it could be for the oral cavities, it could be, I mean, bad, poor oral hygiene. People have a lot of, plaque, food debris around the teeth and the gum, so leading to gingivitis. So someone will complain that when I brush, I bleed. Right. So that's the genesis of the whole thing. So it's a genesis of something called a periodontal disease. So people, apart from people having cavities too, people also lose their teeth for reason of being caries. So it's called periodontal disease. So that's the genesis of it. So periodontal disease is known to cause, halitosis or bad breath. So when you have issues, you have gingiva or your gum bleeding and all that, you have to take it seriously. And then if you're having fillings in your, if you're having big cavities in your teeth which are not being filled, so there can be also areas where food particles can hide, and then bacteria can ingest on them and then produce all these things. So when you visit the dentist, the person will take his time and then go through your medical history to find out whether you have any of these diseases that I made mention, the systemic ones. It could be, or it could be sometimes it could be a drug that you are taking. You know that some drugs cause dry mouth, and then dry mouth leads to halitosis. So some drugs like antidepressant drugs, and people who are being treated for depression, we have some drugs called tricyclic antidepressants. So they are known to cause dryness of the mouth. So that could lead to halitosis, and then some antihypertensives, and then some narcotics, the tramadol that we take and all that. So it's not like when you take it for, mostly when you take it for a long time, that's when, but when you take it shortly, I don't think you have. So then so when the person, the dentist or the medical professional, goes through your history, examine you, the person will be able to, when he's able to find the cause of it and then tackle it, sure you'll be fine. You'll
be fine. There's a question that I think comes to you, Counselor. She said, how do you tell someone with halitosis that he or she has halitosis when they probably do not know that they have it? How do you approach it sensitively so that you don't just shout, oh, we're numbo? You know how that thing can affect people?
First of all, halitosis, when you mention the word, psychologically, it makes it big, right? So let's use bad breath. Yes.
I agree.
Because with bad breath, you have it early in the morning. Right. After eating onions, cauliflower, and others, you get it. So bad breath is quite mild. Halitosis is a bit.
Okay. I'll use that with doctor.
Okay. So, psychologically, telling somebody you have bad breath straight away, it's kind of depressing. You make the person feel bad, right? So, if the person is a close, like a husband, a sister, a sibling, it's easy to tell the person that brush your teeth more. It seems you are having scent in your mouth, like the odor is not that pleasant. If the person is not that close to you, then you should be careful, because I'm just an acquaintance. Then you bob it into my face that you have bad breath. That is also not being courteous. And from the letter too, you realize that the co-workers and people shy away from her, and even some try to avoid her. When she's talking, they try to move their head away. Courtesy demands that when you smell scent, bad scent, odor, you don't make faces. People like make faces and like they shoot their nose and no, it's not right. The show. You do that is being a lady, being a gentleman. You just move away quietly. You don't make the person feel what's bad. Sometimes somebody has fat, then you want everybody to know that this is what happened. It's not right.
I agree.
So if the person is close, you can advise the person, brush your teeth more. Or can you see a dentist? You can suggest it. But if the person is not that close to you, some people advise that you buy the person toothpaste. That is indirectly telling you that there's an issue going on. Can you concentrate on that? Or I can tell the person, visit a dentist. And that is one thing Ghanaians we don't do.
It's true.
Somebody, for 50 years, the person has never visited a dentist before.
Exactly.
We just think it's normal. Let's give them job to do. We should go there. Doctor, you're becoming, right?
I think it's getting better. People are becoming dentally aware.
That's
good. Positive news.
So we thank God. We thank God for it. Yes. Lydia, I'll come to you. Being an everyday person like myself, who I don't have any background in medicine, nothing in counseling, how to talk to people, psychology and all that. I mean, maybe we are the problem, maybe how we talk to people about having bad breath. But in your laywoman's perspective, how do you think we can go about having this conversation? Is it when you intentionally slide the gum to the person when they haven't even asked for it? Or what are some of the ways we can be conscious and sensitive with this issue when discussing it?
Okay, I think we should be very careful approaching someone with such a issue. So I remember I was in a choir, and then there's this lady, you know, when she began to talk, another one of our friends will be doing like this, you know, but I didn't understand, you know, each time that particular person was talking, that lady will be doing this, but I didn't, and she always carry with her gum and the mental,
like the
how to call it?
Things like that.
Yes, whatever they put in their mouth to, you know, refresh the mouth. And she would give to everyone in the choir, but I didn't understand.
Who would do that? Is it the lady with the supposed breath, or the friend who would always cover, who would share the mouth?
The one who will be moving backwards like this and, you know, covering. So that drew my attention to that. So one day she told me that the other person has, you know, bad breath. So I think that was her own way of doing that. But to me, I don't think it's a bad thing to approach someone that is close to me, and then let the person know what is wrong. But I have to be careful the way I tell the person.
Right.
But outsider is the problem. Outsider will be the problem. It will be tough for me to just tell someone that I just met or I know, and then just tell the person that you have mouth odor or halitosis. It will sound, you know, embarrassing. So maybe if I have to give a gift, I would rather look for something that has to do with, to give the person a signal. Why did she buy me this, like this terrain, or why would she buy me that? And then it's a gift, and I gave to you. So maybe that will open a way or a room for the person to you know, come out with the problem he or she may be having, and then maybe the advice will be go and see the specialist, because something that is coming from your mouth, when you meet somebody, you meet the person with your face. When you talk, something is coming. I think, you know, let me crack a little bit here, and I'm like that. I'm cracking you a little bit. This COVID, people are wearing masks, and the mask is helping people with such issues. They won't even worry themselves because your mouth is already covered.
Right.
I'm just crashing. But people with such issue are just, you know, taking advantage on that because we are wearing masks, covering our mouth. But you can't cover your mask forever. The COVID may pass away, and then so this is just by the way. But what I want to say is, it's better you maybe in a nice way let a person know, and then if you need a doctor or a specialist, you direct him or her to the person, or tell him to go and see a specialist, and then be nice, continue to be nice, don't move, because that person, she creates a signal, a sign, you know, whenever she comes, when she's talking to that particular person, she will be there. So you are creating a signal, you are making people uncomfortable, you don't have to do that.
Yeah.
So that is what I'm.
Yeah. Lydia says you don't have to do that. Let's just be kind to one another. I mean, like Counselor said, for sure, suffer in peace. Don't make any noise. Okay, Abuajo, I'll come to you and then I'll ask you, what are some of the ways you think we can treat mouth odor? If you have some specific ways how to go about it, I mean, personal hygiene, what you should do, what you should not do, foods you should eat or not, please share it with us.
Okay, thank you.
You're welcome.
I wanted to touch a little on what the panelists in the studio said and what Sister Lydia also mentioned. You know, there are a lot of people that have problems that know they have problems. Okay, so maybe I'm overweight. I know I'm overweight. It isn't you who tell me that I am overweight. Okay, so you can only suggest to me. I believe people that have bad breath or mouth odor or what have you, most of them know they have it. But sometimes they don't tackle it in the right way. They just leave it unattended to. And they think that, and sometimes when you have such problems for long, it becomes normal to you. So when you go out there, you feel that people are not smelling my bad breath or they can't really smell it as I think I have it. But people actually do smell it.
Right.
So the advice is that if you know or you've been told or you already know that you have a problem with your breath, don't brush it off. Don't think that I know, but I feel that it has become part of me, so there's nothing I can do about it. Actually, as Doctor said, something can be done about it. It is treatable, just that it takes a lot of time and effort. You have to put in all your efforts so that you can get maximum results. But the most common cause of bad odor or halitosis has to do with hygiene problems. So a lot of people don't take very good care of their mouth hygiene. The dentists will always tell us that we brush and we forget about flossing and then rinsing our mouth with mouthwash and what have you. We are not used to that here in Ghana. It's not very common here, but it's very important. It's very important in our healthy mouth regimen or healthy oral regimen. It's important that as you brush, Doctor mentioned, you should include brushing your tongue very well. We brush just our teeth, just the outer part, and then we don't include the inner mouth. It's important that you brush the tongue very well and make sure you are bringing whatever it is beneath the tongue outside. So that is one way. And also you should floss. You should floss. There's something called dental floss. It's very important that the debris in between the tiny part of the teeth is taken out, because as they lodge there, it breeds bacteria. The bacteria in the mouth, the normal bacteria in the mouth gets multiplied. And as they multiply, they cause bad odor. So it's very important to floss as well. And using mouthwashes. She mentioned that she's been using it. So I believe it's beyond that. So also Doctor mentioned that you have to avoid dry mouth. So it's important that she drinks a lot of water. This point in every health discussion, we bring it out that you should drink a lot of water. It's like we just talk about it and people brush it off. But in every disease condition or healthy eating habit, it's one thing that you should include: drinking a lot of water. Drinking a lot of water means that you should be mindful of the weather condition. So now the sun is out, the sun is very scorchy. And so if the normal amount of water you should drink in a day is 4 to 8 glasses of water, that is like 3 of the sachets, 2 of the sachets, 2, 6 of the sachets in a day, sachet water in a day. So now, because the weather is hot, you should drink more of that, because you are being dehydrated. As you take in the water, passing it out as urine, you are sweating and what have you. So you should take in a lot of water so that it will replenish whatever you've lost. Dry mouth causes a lot of bad breath. And if we experience it in one way or the other, during the day, when you realize that you've not drank a lot of water, especially in this COVID era that we are covering our mouth and our nose, you realize that as you speak, there's this bad breath coming out. So a lot of water intake is also very important. And it is important that if she likes sugary diets, she stops it as soon as possible. A lot of sugary diets also causes bad breath in the long run. So these chocolates, biscuits, what have you, sugar itself, and anything that causes a lot of sugar. Some people like a lot of sugar. As much as possible, she should cut down on those and look for alternative ways like honey and the rest as sweetness in her foods. So that is what I'll talk about. Also, in respect to diet, taking in onions, garlic, spicy foods also contributes to bad breath. So if she likes that, she should buy kinky and then asking the vendor to give you some more onion. So because she knows her problem, she should avoid those things for now. And a lot of they all contribute to bad breath. So she can start with these things. But as I mentioned earlier on, there are some things that you can't do on your own. You have to seek help. And it's not a problem. As Doctor mentioned, a lot of people are now seeking help for oral problems. So she should just walk to any dental clinic and then she'll be taken care of.
Thank you so much for that extensive information. Counselor, I'll come to you and I'll ask. So aside this issue of bad breath, let's just look at self-confidence on its own. What are some of the tips you can give us, this one, the Apple, to take ourselves from the situation where we feel so down and antisocial and we feel we've lost our self-esteem to back to the confident woman or man? What are some of the tips you can give us?
First of all, since we are Christians, so you should know that David said, I'm wonderfully and fearfully made. Right. So first of all, believe in yourself that you are one unique person and God is particular about you. He sent Jesus Christ to come and die just because of you. So everything that you do, know that I'm important, I'm special. No matter what you say about me, somebody bigger than you thinks I'm worth it to sacrifice his life for me. And you must know that in this life, we are not equal. The fingers are not equal, so we are not equal. But I have something that you don't have. You might be tall, but I'm also short. So certain places that I can enter, you can't. You might be very beautiful, but I could also be
very intelligent.
Yes, intelligent. You might be fair. I'm also chocolate. So, you know, it's the spice of life. So we all emerge to form one big whole. So you must believe in yourself. And as she's saying, she was good, she was sociable and everything. Because of this, she's feeling down. Know that she should encourage herself. She should pick herself up from where she is. She's financially sound. She's having a secure job. Some don't have it. And she's having the gift of life. So what other people are doing, shushing her and all that, she knows that they have the problem. Although she's having that bad breath and all that, she needs to deal with it and know that the people who are around and doing all those things, they are not quite courteous. They could not have done that. And one other thing you have to know that as individuals, we all go through situations. Life is an uphill climb, so it's rocky. And if it's smooth, you couldn't have gone up. It's rocky for you to be able to navigate and go. So whatever you are facing in life, whatever you are going through, all shall pass. And whatever people are talking about you, whatever comes by 2-3 weeks, it's gone. Different issues are in. So she should just let go and focus more on getting treatment and getting her self-confidence back. And she needs to talk to a counselor because now she's thinking that the guy left because of that. The guy never loved her. There was nothing like love. She should be happy that the guy just left. Because somebody who loves you will be there to help you through it. He will even take you to see a dentist. He will be there to guide you, help you, brush, do this. But the guy is not meant for you. So she should just let him go. Love will come. And one other thing I have to say is bad breath. You are talking about the ladies and all that. Let's bring it to marriage. Some people, when they go, when they want like before you go to bed.
Right.
As couples, it's a must that you brush your teeth because things might go on.
Okay.
You don't need to come and give me bad breath and all that. So married couples, it's a must. You need to brush your teeth before you go to bed. And the children too, you must take care of them when they are young. Let's train them how to brush their teeth well, because some, you know, I teach in the second cycle school, and some students, you could see that they are bright, but they are quite antisocial. It's not that they want to be antisocial, but because when they talk, the students, how they behave.
Students are mean.
So they give them names, so. And some names, we hear them, we teach about, you start laughing. Right? Then they become shy, they can go for positions, but because of that issue and the name they are tagged with, they can't move on up. So the parents should also, when they are young, they should teach their children how to do the proper thing and take them to the dentist.
Right. Doctor, our time is fast spent, but I'll ask you finally, how, if it is, let's say, you mentioned that it depends on what is causing it and how the treatment will go, but let's say if it is oral hygiene, is there a particular to brush your teeth? She said she's using plantain peels and charcoal. Is it even advisable to use that? The mouthwash? Like, what are the petty things to do to take care of your oral hygiene?
I mean, to summarize, I mean, oral hygiene techniques. I mean, so we as we all know, we have to brush our teeth twice daily, and then it's recommended that even the brush that you use to brush our teeth. A lot of people think that using a hard bristle brush to brush is is the way to go.
There's this brand that won't mention it, but it's very hard.
But that's not the best, because the hard brush will even end up causing tooth wear and will give you worse oral hygiene. So you have to use we recommend that you use a soft bristle brush, and as they said, you have to floss your teeth. To use the floss, you can use mouthwash too. They are adjunct. They help to reduce plaque, food debris accumulation around the teeth too. So, and then a lot of people also have some prostheses in their mouth, like dentures, artificial teeth, that they, when you see some in the clinic, you see that it's not tidy. They don't keep it very well. So these are all, things that can cause, bad breath and or halitosis. So, when the person comes and then we assess and then see all these things, we advise the person, and then also we advise as dentists for us to also be coming to to come for regular checkups at least every 6 months, or if you can't do it at least once a year, so that we will assess your oral hygiene, and then if there is anything we could do to help you, then we do
that. Right. Okay, I have some comments coming in. I'd like to take some before we go. This one is from Setina Ifwa Arthur, who says she should be grateful to her ex for mentioning it to her, because many people go through halitosis. Many people who go through halitosis do not even know they have it. She needs to see a specialist. A simple cry. And then I have some coming in as well. This one is from Ruth. Ruth says, visit the hospital and start building your self-esteem. It will help you even after seeing the doctor. Vivian Sewa says, good evening. We thank God for Hope TV and the good programs. Evie, this halitosis thing, but she can go and see a herbalist and pray to God she'll be all right. A friend is facing the same problem, having difficulty in relationship, friends and stuff like that. Okay. Ofori says it's a problem in the head, and doctors or good herbalists can help. Hope God help you soon. Is there a problem in the head, or is one of the other?
So as I said, I think the person was trying to talk about the sinuses. The sinusitis. So those people who have issues with that also tend to have.
Okay, this one says visit the hospital, and then this one says, oh, this is sad. Indeed, it is sad, but I'm sure the discussion has been an amazing one and an educative one. You have gotten some good tips from it. Visit the hospital, see a dentist, get a diagnosis. For it might be something else. If there are no underlying disease or causes, you can get it treated. But I'll come to you, Lydia, again in a short word for you to say hi to people in Ghana, because you have been away for a while. Say hi to whoever you want to say hi to, and then let's say in a sentence, finally your words to the lady.
Okay, thank you, Ibi. I want to say hi to all people in all people of Ghana.
Okay.
I used to teach at Morning Glory International School at Takoradi. And I want to say hello to them. And then Ejiba International School at Takoradi. And then Central SDA Church in Takoradi. So I want to say hello to everyone and God bless you. So and another thing about the program, about the topic, I want to say, be the person who brought this letter, be confident, don't give up on yourself. So be confident and keep on, because like I said in the beginning, I was so happy that she hasn't seen any specialist, so she has more to do.
Yeah.
And then she should go forward, and then she should rinse her mouth every night she's going to sleep, like everything has been said. Yeah, take care of your mouth, and then they will find out the root of the cause, because it doesn't just happen. It could be the root of the cause. And then another thing, we have to, if I take her to the Bible, Psalm 139, verse 14 says, we are fearfully and wonderful made. So every time you think about it, you have to believe that you weren't made this way. So it could be solved.
Thank you so much, Mrs. Lydia Odun, for coming on the show. I'll come to you, Awadri, and I'll ask you for your final words, and then say hi to whoever you want to say hi to.
Okay. I want to say hi to everyone watching me, and my family from far and near. Hi to everyone watching me. God bless you, Evie, for this beautiful program. You are really educated on a lot of things. My final words to this lady is that it's a problem that can be solved. In fact, I always say that because someone has a problem that can't be solved. If I have HIV, there's nothing I can do. There's no cure for HIV now. But the good news is that your halitosis can be cured for good. So you should find the way to go about it. And that is by visiting a proper dentist, the proper dental clinic, so that they take care of this for you. In the next few months, you'll be free from this, and you wouldn't even be talking about it again. And you can gain your confidence back. The counselor also mentioned that she should see a counselor, because it's important that as you withdraw, it's important to come back into society. To be able to regain yourself back, you need someone to talk to you. So she should as well.
Thank you so much, Mrs. Abajabano, for coming. Counselor, what should she do? And then whoever I want to say hi to.
Dear lady, don't give up on yourself. There's more to life than what you are going through. And at the right time, the true gentleman, that wonderful guy, will come into your life, and things will be good, will be perfect again. In his time, he makes all things beautiful. So see a dentist and come and see us counselors. We are going to help you. With life too, you need a boost, right? Yes. So that you put the 1 and 2 things together. You get that nice guy you are just checking out. And hello to everybody, to St. John's teachers, and most of them are watching me. So bye-bye.
Finally, Doc.
Okay.
Your final words to her, maybe a sentence, and then if you have anyone to say
okay. So as we all said, I mean, all hope is not lost. I mean, she has a long way to go. She has to seek medical or dental treatment and then advice. So when she comes and then we assess, and then, as I said, there are other people too who might not, actually have halitosis, but they might think that they have. So if you think that, it's beyond us, then we have to refer you to, a psychiatrist or a therapist or a counselor for them to also take over. So we will do our bit, and then I'm sure she'll be fine.
Yeah.
And then also to, I say hi to all my family, my friends watching me, and then all my patients too. I say.
They should get well soon.
Yes, they should also. I'm reminding them of their appointment. So.
They should come.
Yes.
You hear, doctor, whoever you are, all of you out there, please come to the hospital. It's waiting for you. Thank you guys so much for coming on the show. I can't thank you enough. the information was so knowledgeable, and I hope the next time I call you, you still come and then grace the show and share all these amazing tips with us. Thank you guys at home for watching, for joining me every Wednesday. You welcome me into your home. Thank you to my amazing crew. I always say this, it takes a village to create a TV show, but you guys are just amazing. Thank you, Shades and Glow, for our makeup. Doctor also gets a little makeup, so thank you for that. And we'll be back same time next week with another interesting topic. Continue to watch Hope TV and all our amazing content. And I'm sure you will have a lovely evening, just like we in the studio hopefully will have. See you same time next week. My name remains Evie, and have a good night.